Adult social care covers a whole range of things. It's everything from help with daily living, whether that might be helping you to make a cup of tea or get the shopping or get out of bed if you're in your home, to much more serious things like needing to actually live in a residential care home because you may have dementia or you may have really serious problems just getting around and looking after yourself at all. So from relatively small but important tasks of daily living right through to being looked after to be able to manage to live a good life at all. Two really big issues affecting social care at the moment. The first is that there have been significant cuts in provision over the last decade. That means that fewer people are entitled to free social care than they used to be, and the quality of that care is often not what it could be. But the second is that only those who don't have significant income or assets of their own get any free social care at all at the moment. So if you happen to own your own house or have some money in the bank and you require social care, you essentially have to pay for that until all of your assets are gone. And because some people require hundreds of thousands of pounds worth of this towards the end of their lives, they can lose all of the assets that they've built up over their lives. So two important but separate things. One is the quality and availability of social care as it's currently designed for people who don't have much in the way of assets. And the other is that if you do have assets, this can be a catastrophic cost for you. Well, if you're looking at the problem of catastrophic costs, of the fact that some people need to pay tens, hundreds of thousands of pounds for their care, you need a system which says, for example, if your costs go above a certain level, that might be £20,000 or £50,000 or even £100,000, you say, if your costs go above that level, then whatever your assets, we, the state, will step in and provide that. Now, of course, you need to fund that, but that's perfectly manageable. It's a few £1 billion. Now, £1 billion is quite a lot of money, but in the context of the 800 billion that we spend as a country through government, it's not such a big deal. It's something that's perfectly affordable. The question is, do we have the political intent to make it happen? I think the message for government is we know that this is a really serious problem. We know that the impact on the quality of life of people who are getting poor social care at the moment or who are facing catastrophic costs is terrible. This is something that only the government can sort out. This is not something that individuals or the private market can sort out. So this has to be at the top of your priority list. It is affordable. You need to find ways of just getting a relatively small amount of money. There's quite a lot of consensus about actually what needs doing. We just need to get on and do it.